Well, we're back here with Dr. Gregory Leisle, a dentist, actually a dentist who treats children exclusively in Fresno. Dr. Leisle, tell me, or tell the viewers here, there are some parents out there, and we feel, parents feel that, you know, the first children, the baby teeth, as we call it, if they get a little bit damaged and not necessarily hurt and have the need for a filling, why do it if in a couple, 2-3 years that thing is going to come out anyway? Do you have some answers to that?
Well, it's very important. I have people that ask me that once in a while because they feel, well, why put money into a teeth for a few years and then they're going to be gone, like you said. They're very important to have in there. The 20 teeth we get as a young child, as an infant, that progress with us, they stay in there. The front ones stay in until about 6 to 9 years of age, and the back ones 10 to 12, sometimes 13 years of age if it's a male. Now, if we lose teeth early, what happens is loss of space happens if a space maintainer is not made. If fillings aren't first done when there's a small cavity, then what happens? They become crowns. If the crowns are not done, or nerve treatments sometimes, then they lose the teeth, like I said before. And then space maintenance is not happening unless the space maintainer is placed in the mouth. And then when a child is older, they've lost space and the permanent teeth don't have enough room to come in. So, like in America, we have many children that have crowded mouths anyway. And so if they lose teeth prematurely, then they're not going to have even more room. So they're going to have a very expensive orthodontic bill when the child is 10, 12, 13 years of age. So, yes, they are very important. Not to mention that when a child has cavities and they have pain at school, they're not able to concentrate on their schoolwork. They're having pain at home. They're not going to be eating very well because more solid foods are going to bother them. So, it's just not a good thing diet-wise, health-wise, and also education-wise.
Well, it almost looks that somewhere Mother Nature or God, whoever and whatever it might be, has designed it for a reason that way. That there is baby teeth coming in and X amount of them and them going out at a certain time and not before.
That's right. So the mouth is developing. When you get the baby teeth in, there's the front teeth obviously come in first, the bottom usually first, and then the top ones. And there's a progression of events. And if this is thrown off by just a minor beginning, like I said, a cavity, then that needs to be restored so that the integrity of the mouth is going to be restored. It doesn't seem like much. It's like being 1 degree off in a trip. If you're on a railroad track, you're building a railroad track down the road, and one rail is just slightly off a degree. Well, you get out there about a mile, and you're way off. And right. So the situation here is you have some small cavities that are not taken care of, and then all of a sudden you have major problems down the road. It may not be for a couple of years, but why
right.
make it more expensive?
Right. And also, what do you think is your opinion? I mean, you're dealing with children so much. If and when children have a, let's say, not so good looking mouth, that the tooth is gone when it shouldn't, do you know what I mean? It's always about who shouldn't. Like if we get a wrinkle at the age of 70, we're not so worried because it's kind of close to normal. But we get a wrinkle at the age of 24, then it's like something is wrong. So you lose a tooth, at a certain age. Do children feel the pressure, the peer pressure, kind of like that they're looked at, laughed at as being different? And do you find them to be self-conscious, no different than us adults already?
Good question. Children, there's a couple of different points to that. Children usually, they will not be as aesthetic conscious as the adults are, depending on the age group. If you look at a 3- and 4-year-old, they're not so much aesthetic concentrating. They don't care so much about what their looks are, except for the families where it's really important to the parents. But when they get into preschool and they lose a tooth early in the front, one tooth is not a problem. But when they lose multiple teeth, then they look different than everybody else. It's kind of like on the Sesame Street program on TV. You know, what are all the things that are same? What are the things that are different? And so the child is looked different than the others is sometimes a point of criticism to the other children, and they'll pick on them. So what we usually recommend when a child loses a front tooth, one individual tooth, it's not much of a problem. But unless they're in commercials or some kind of a TV, or movies, then they go to have that one tooth replaced at an early age. If they're missing more than one tooth, though, it is a good idea, like you said, as far as aesthetics for the children, to have that replaced with what we call a child partial. And that's something that's cemented in the mouth, and the teeth are on there, looks like the other teeth, and so then they're not having problems. Because usually by the time the children get into kindergarten or first grade, many children are missing teeth, so that's not a problem. But at 3-4 years of age, it can be. Now, and that's just the front teeth. Now, the back teeth is a whole different matter. The back teeth, if they're lost early, they need space maintenance, not for aesthetics, but so they don't functionally lose room and then have other problems.
Dr. Leisle, we're going to talk about that in another time because this particular segment we do have to kind of end it off. So basically, you've got to make sure that you keep the teeth in it as long as they're supposed to be in it for a child for all the reasons you mentioned. Thank you very much,
yes.
Dr. Leisle. Okay?
You're very welcome.